Special events in the two Virginias, issues that matter to you, people making a difference. This is In Focus on WVVA with your host, Greg Carter.
Good morning and welcome to this edition of In Focus. You know, I think it's safe to say that nearly everyone watching this program this morning has either directly or indirectly been affected by cancer. And here on WVVA News, on some of our news programs, we do share a lot of stories about studies, about risks, about potential ways to lower your chances of developing certain types of cancer. We also share stories of survival. And this weekend, we have a great opportunity for you to hear from a young lady who recently celebrated being cancer-free after a journey that began with a stage 4 colon cancer diagnosis a little more than a year ago. We'll talk about that a little later. She also happens to be a very talented singer as well. But right now, we are joined by oncologist Dr. Joseph Baisden, and he has a lot of information and tips for you this morning that we hope you'll find useful and helpful for yourself, maybe also share with family members as well. Dr. Baisden, thank you so much for being with us this morning.
Thank you, Greg. Appreciate the opportunity.
Anytime. Also here representing, as I want to mention, 21st Century Oncology. Just talk a little bit about your background. Let some folks know more about who you are and where you're coming from. And I know you've been on the program before, but folks may not have seen that. So let's introduce yourself.
Sure. Well, I'm a native West Virginian. I grew up in the Eastern Panhandle in Romney, in Hampshire County. And after high school, I was in Morgantown, WVU. I was there for 13 years and got 3 degrees there, but more importantly, my first 2 children were born there. So that's what I always think about when I think about Morgantown. That was our first home. And after that, I went to Charlottesville, to the University of Virginia for residency training, my specialty, and then Louisville, Kentucky for 2 years. And then I was an assistant professor at Eastern Virginia Medical School in Virginia Beach and Norfolk area for 2 years before returning to 21st Century Oncology here in Princeton, West Virginia. Now, I'm medical director for both centers in Princeton and Lewisburg. 21st Century Oncology of West Virginia is what we call that.
Amazing. What made you decide that oncology was the direction you wanted to go in?
You know, I didn't really have any formative experiences with family members that some other folks have as their story, but really, I knew I wanted to be a physician going into school at WVU, and as a graduate, I started volunteering at Ruby Memorial Hospital. And they have an outstanding pediatric oncology program, and I just fell in love with the children that were being treated there in the oncology floor, and that really, I guess, led me to where I am now. I don't treat pediatric patients now, but that kind of led me down the path of oncology.
A lot of efforts by various groups out there to raise money for research. You know, still looking for that cure, looking for advancements. You know, talk to me from the medical side of of that battle. And as far as what you're seeing and the progress we're making, you know, where are we now compared to 10 years ago, 20 years ago, 50 years ago?
Right. So the home runs we've hit in cancer care for adult cancer care have been screenings. Yeah. So that's old data that proved the benefit decades ago, and that's really where we've made huge strides. And now we're trying to make more strides for individual cancers by coming up with therapies that are tailored toward the cancer or the patient. And that's really where the future of cancer is going to be. Hopefully at some point we can have a biopsy that's analyzed genetically, and each patient's cancer can have a specific treatment that we know to be highly effective. We're not there yet, but there are some diseases that we are at that phase, but we're moving toward that, hopefully with all cancers.
What do you see most of in your patients in our area? What kind of, I guess, repeats are you seeing as far as across the board with folks in southern West Virginia and southwestern Virginia?
Talking about the most prevalent cancers?
Types of cancers.
Yeah. So the most prevalent cancers here are the tobacco-related cancers, lung cancer primarily, but also there's probably 8 or 10 others, head and neck cancer, esophageal cancer, bladder cancer. There's a host of tobacco-related cancers. That is because we're at the tip of what they call the tobacco belt, through Appalachia all the way down to Louisiana, basically. Additionally, we have the other standard highly prevalent cancers, colon cancer, bladder, breast, prostate. Those are pretty highly prevalent here. We see a lot of primary brain tumors as well, which is pretty pretty well in line with other areas. We don't have any outlying diseases that would surprise you.
You mentioned screenings, and we want to talk a lot about that this morning. Is that what you consider to have the biggest impact right now on finding a cure, but also getting people, treatment as early as possible?
Absolutely. That's the key. So finding it early and treating it when you have a much higher chance of success and cure. Yeah. Really, the most dramatic example of that is colonoscopy. Yeah. Every time a polyp is removed, you've removed a precancerous lesion. It wouldn't be guaranteed to turn into a cancer, right? But really, that's what you've done. And so many countless people have had that done. And so that really has a dramatic effect. And really, if you look at the data, and I did bring a slide, I was hoping we could show that.
Yeah, we've got the screening slide we want to pop up there. There you go.
That's really helpful because what it points out is this is data from the period of, I think, the early 90s through 2009. Okay. And what we see, the separation in those curves represents the number of people that have been cured. Right. It's likely mostly due to screening because we're talking about breast cancer, prostate cancer, and colon cancer. Right. And really through 2009, that total number cured topped 1 million.
Wow.
So we're probably getting close to 1.5 million now, 5-6 years later. And again, that's all because of screening, all because we can find with breast cancer who can get a minimal surgery and treatment, men with prostate cancer that can have a prostatectomy or radiation and be cured.
So that's saving lives. So what can we do to improve on that number and get more people to see the effectiveness of those early screenings?
It's very easy. Get more people to undergo screening. Nationally, the utilization rate of screenings is probably around 60%. Yeah. Here in West Virginia and these parts of Virginia, it's a little lower, 55 to 50%. So if you look at that number of people that have been cured, it probably could be doubled if all the folks who were appropriate for being screened have actually been screened over that period of time. Right. So that's one thing I can say that would be the easiest and low-hanging fruit. Yeah. Everybody gets screened.
You have a lot of people, I think, who, with other ailments and things, they wait for symptoms, they wait for signs, they wait for some reason to have to go to their physician, to an oncologist, to a surgeon to figure things out. When it comes down to screening, it's about more so understanding your body, understanding your family history, understanding a lot of other factors to say, okay, you can't wait. It's not, at least it's not advisable to wait until you feel something or something's not right to do that. How can we encourage, more people, and especially men, because we don't like getting out and dealing with you guys very much until, how can we encourage more men to take those steps to get out there? How can we encourage wives and girlfriends and whoever to get those guys out there so they can take care of themselves?
Well, really, the things that I see most effectively is I have a number of people who come to me and they'll say, as a man with prostate cancer, I'm here because my wife made me go do the screening. And they're disappointed when they should be thankful. Yeah. And when I have women come say, my sister had breast cancer and she made me go do the screening. Those are the folks that I really say, you need to go back, hug that loved one, because they have potentially saved your life. Yeah. And so that's what I would suggest is force your loved one to go do it. That's the most effective.
Get them out to do it.
Yeah. The other things, the community supports these screening efforts. Several of the local hospitals, including Princeton Community Hospital, has yearly screenings that are offered for free for prostate cancer, for breast cancer. They just did that in the fall, had a very successful screening of several hundred people. So utilize those resources.
Yes, absolutely. So if cost is a factor for you, if that's a concern, you can look for those things. Call your local hospitals and call around and find out who's doing those, so that you can be in line and waiting for one of those at no cost to you. And as you say, it's about saving lives and could save your life, a loved one's life. Just to stand in line and wait for a little bit and have those screenings. So we're going to go to commercial break and come back and talk about some of the ways to reduce cancer risk and some other important information that Dr. Baisden has for us. So stay with us. We'll be back after this commercial break. Welcome back to this edition of In Focus. We are so thrilled to have Dr. Joseph Baisden with us this morning. We're talking about cancer screenings and all important cancer screenings that can help save lives and change that mortality rate when it comes to a lot of different cancers that you can screen certainly early for. And we want to talk now just about reducing the risk of cancer. We do a lot of stories in our health blocks and things like that on different studies and things that are out there on, eat this, don't drink this, and, and sometimes it just gets confusing for some of us on what we're supposed to do or not do and expose ourselves to. But, some of the basic things I think we can all kind of absorb and understand. But just from your perspective, what can we do to control some of those factors, Doctor?
Sure. Well, probably the majority of factors in cancer are ones we can't control. Age, family history, these other things. But the ones that we can control are significant. The biggest factor I mentioned earlier is tobacco use. Simple use of tobacco increases your risk of multiple different cancers. Depends on which type of cancer we're talking about, but things like bladder cancer, cervical cancer, it doubles the risk, and that's pretty significant. Things like lung cancer, it makes your risk 20 to 30 times greater than a non-smoker. And that extends to your non-smoking secondhand family members. They have double the risk of someone who's not exposed to secondhand smoke. So that's the biggest one, and that's one that's the hardest to do for folks that are addicted to tobacco, but there are things in place to help. Other things that have a really big impact, probably the second biggest one is actually controlling your weight. The relative risk of cancer goes up with the amount of overweight folks are. So just being in the overweight category increases the risk by about 8 to 10%. So that's a significant increase, not as much as things like tobacco use, but it does increase it for multiple cancers. But if someone is in the morbidly obese category, they have a 40 to 50% increased risk. And not only then do they have that higher risk, it's harder to treat because surgery becomes less of an option for some of these folks, and then the actual going through radiation or chemotherapy becomes technically more difficult. So that's probably the second biggest thing. Other things are nutrition related, and there was a good study out of Harvard and Boston of a large number of women where they decreased the red meat consumption, increased the fruit and vegetable consumption, and they limited the alcohol consumption to 1 drink or less a day. And they saw a relative decrease in cancer, overall different types of cancers for those women as well. It was a small decrease, but a significant one. So that's something else that you can do to control it. The last thing, the other plug that I always tell my patients, the things that they can do is take a daily multivitamin and a daily baby aspirin. There's good studies where patients were studied for cardiac events, and those that received an aspirin and those that received a multivitamin, out of these tens of thousands of patients, they went back and mined that data. They noticed that those patients that were receiving those interventions for their heart actually had less risk of cancer too. So that's really kind of the things that have solid data. There's a lot of other anecdotal things you'll hear about, but those are the ones that have solid data.
So just a combination of different things that we can all do, that we can control. Those are, and when you think about other things like, type 2 diabetes and other things like that, a lot of similarities there with the things that we can do to reduce our risk and be somewhat healthier in a lot of different ways. So some good tips there. And again, things that we've heard a lot, I'm sure. Hard to do, hard to make those changes. One of the things that some friends of mine talked about was just the idea of if we all understand the risks, we all understand the things that we can do to kind of reduce our risk, the benefits of kind of attacking this from a group effort. not just, solo effort, I got to do my part, but getting together with family or friends and trying to make a group effort to make change, especially if you know that you have a family history of cancer and things like that. And that's one of the things that I'm no expert, so I can't throw it out there, but it's one of the things that I wanted to toss out, just that you don't have to do it alone.
Absolutely.
These are all things that you can do and get help from, get advice from the experts, but also take advantage of family and friends to help you push through. If you need to quit smoking, if you need to change your diet, need to make some changes and take those supplements and vitamins and minerals and all those fun things to help you through it, because it is tough to make wholesale changes on your own, especially if others around you are not. Doctor, let's talk about some of the advances out there that are helping patients when it comes to cancer treatment. And I know you've got some new technology that you all are working with 21st Century Oncology.
Well, back to the screening, there are big advances in screening technology regarding mammography, particularly, that's improving the detection capabilities and decreasing the unnecessary biopsies. So that's one thing that's been continuously improving. Regarding folks diagnosed with cancer, surgical techniques have been geared over the last decade to becoming minimally invasive. So we hear a lot about folks having the robotic surgery, having less downtime, less time in the hospital, and ultimately, really, all these are geared toward continuing to have excellent control of the disease, but minimizing the side effects of the treatment from surgical aspects. Additionally, in kind of the parallel world, when folks can't have surgery or needs radiation after the surgery, the radiation technology has continuously improved, certainly over my career, and we are seeing an excellent continued ability to control the disease with decreasing side effects, because our technology is allowing us to decrease the dose to the tissue that we don't want to treat.
Right. It's something that and I'll ask you the question, but when we see radiation and how it's used today and the changes in it, it seems like people are able to bounce back a little faster, or at least, and I know it affects everyone differently, but we see people who aren't. It used to be that everyone loses their hair. Well, you see people who aren't losing their hair. You see people who are able to get back out on the job a little faster, or out to their careers a little quicker. Is that one of the things that you're noticing, or is that people are able to go in and handle 10, 12 treatments, and when they're done, and they're able to move on and do good things?
Yeah, absolutely. I'm seeing less breaks for folks regarding work. I've seen a lot of folks continue their work without any interruptions during their treatments, because it's not causing them a lot of difficulty. So it's not always the case, as you mentioned, but I'm seeing more folks able to do that during their treatment. It all depends on the part of the body we're treating, the volume of the body we're treating, but we're seeing improvements there. One way that I measure that is breaks from treatment. So in the past 10 years ago, we would have to give 10 to 20% of our patients a break for a week or so during their treatment to allow skin to heal or some other problem to improve. Now it's relatively rare that I have to give folks a break for treatment, so that is a good measure to me that our technology has improved these treatment-related side effects.
Well, we were talking before the show just about some new equipment, some new things you have at the Lewisburg office. Tell me a little bit about what that is and how it works.
Sure. So with our association, or our parent company, 21st Century Oncology, they have the mindset of providing the most advanced technology to all of their clinics, even the most rural clinics, because that's what they've built their model on. And so we've been fortunate to have a top-of-the-line helical tomotherapy machine here in Princeton for the whole time I've been here, for 4 years. And now we've just started treatment with a new helical tomotherapy machine in the Lewisburg office, so it matches. It's really the sister to our machine here. It's a newer version with all the bells and whistles, but it's able to allow us to do all of the advanced technology-based treatments, stereotactic treatments, and things that give us every option that anybody anywhere can provide.
It's amazing. Very good, Doctor. Thank you very much. We're going to take another commercial break, come back and continue to talk more with Dr. Baisden about 21st century oncology and some of the offerings, also a recent award that they were given. We're also going to talk about a concert event coming up this Saturday that Dr. Baisden and 21st century oncology have graciously decided to sponsor. Thanks for staying with us, and you're watching In Focus here on WVVA News. Listen, I want to tell you about a young lady. Her name is Amanda Noel Wilcox. I met her several years ago, back in 2009, actually in Lewisburg, West Virginia. She was part of a trio called Kimber Rising. They were opening up for a concert event there at the Rema Christian Center, and I met those young ladies there and sparked a friendship with them that's lasted over the years. Amanda has since gone solo, and right as her career was ready to take off a year ago, she went into the doctor's office complaining of some digestive issues and stomach issues. She walked out with a stage 4 colon cancer diagnosis a short time later. She felt her career was really going to be derailed at that point. She felt her outlook was grim, but a lot of people rallied around her and gave her a lot of encouragement and hope. And over this last year, from surgeries, it also spread to her thyroid. They were concerned about her singing again. But over the last year, she's persevered through surgeries and chemotherapy treatments, and she called me in August and said, "Greg, I want to get back out on the road, and I want to keep singing." And she asked if we would bring her to our area, and thanks to very generous sponsorship by Dr. Joseph Baisden and 21st Century Oncology, we are bringing Amanda Noel to Bluefield, Virginia, Harmon Chapel, Bluefield College, December 19th, 7 o'clock, free admission, and we're encouraging all of you to come out. She's going to be singing Christmas songs. She's also going to be talking about her journey from cancer diagnosis to just this past November being able to announce to the world on social media that she is cancer-free. She also got married in November, so it's been a crazy time for Amanda, but we would love to see you come out and share in this wonderful night. Again, awesome Christmas song. She's an amazing singer. She's bringing a few members of her band, and but she'll also talk about her journey and also offering some encouragement and hope to those, excuse me, in the audience there on Saturday night. So we hope that you come out. You know, I asked you this earlier. You know, you guys jumped right on this when I called and asked if you would be a part of this. What was it about her story and her situation that made you personally and 21st Century Oncology say we're on board?
Well, it's just an inspiring young woman fighting through the odds and finding the faith and the help from God that gets most of us through these kind of problems. I've seen this kind of story a lot of times, and I really hope that it inspires other folks to fight through their tough times in life, whether it's cancer related or not.
Yeah, it's a big part of what you do. I mean, it's you know, people see the MD and they think it's just the technical side or the treatment side or the surgery side, but a big part of what you do also is being in there with families and talking with patients and families about their diagnosis and their situation. It's personal. It's painful at times. It's difficult at times. You know, how important is that doctor-patient relationship and that ability for you as a human being to be able to speak to them as a human being, not as just a patient or...
Well, you're absolutely right. It's terribly painful at times, but it's also unbelievably uplifting for me personally, and that's why I do what I do. It's that person-to-person connection and being able to help folks, not just driving the machine and showing it what to do, but helping them through the tough times and helping those folks that need inspiration to come every day and to get this life-saving treatment. It really is a wonderful thing to be a part of, and it's not just me, it's the whole team that we have at both of our centers, and that's why patients, I feel, do so well, is because they are constantly surrounded with kindness and love, and that really makes a huge difference in outcomes. It really does.
You're speaking on patient care, and as we were waiting today, I got the press release on 21st Century Oncology winning the 2015 Guardian of Excellence Award by Press Ganey Associates, Inc., and it's all about patient care. I'm certainly proud of that honor.
Yeah, I'm extremely proud, and that was for the Lewisburg office. I feel it's deserved in both of our offices. But what it is an award given by the Press Ganey folks, and it represents the clinics that are in the top 95th percentile in patient satisfaction. I had no idea that you gave such an award until last week when we received it. We got this shiny trophy in our office up there. It's beautiful, and it is so well deserved because the staff there are just, they treat everybody as family, and we have the technology to provide world-class treatment. So I think it's very well deserved.
Absolutely, absolutely. So a lot of great information that you've offered here this morning. We hope that you're able to take some of that with you and let that marinate a little bit, especially the importance of getting those screenings early. And I hope that graphic was able to show you the number of lives that are really being saved because of the strong push for screenings to get out there early and get those tests done in advance. Don't wait until something bad happens. And now I want to take one more opportunity to, again, push this Saturday's concert, December 19th, 7 o'clock at Bluefield College, Harmon Chapel there. Free admission. This is good for adults. This is good for kids. Amanda's more of a pop-style singer. It's up-tempo, but she's amazing. All of your Christmas favorites will be performed on stage there that night. So we hope that you come out and see us and spend some time with us and be encouraged. If you've had to battle cancer, you've had family members, I guarantee you will have an amazing opportunity to be encouraged that night to stay strong in not only your faith but in your fight to heal and to beat this thing. So we have about 10 seconds, Dr. Baisden. Anything else you'd like to add before we head out?
I don't believe so.
All right, wonderful. Thank you so much. Thank you, and again, thank you for your sponsorship of that event. We really appreciate that, and we hope again that you've been encouraged this morning to make some changes in your life and take care of yourself. We got to take care of each other. That's going to do it for this edition of In Focus. Have a great night. Have a great weekend.